Let's do a quick measles update. It is May 23rd, and this is my new office. As of yesterday, there were 1,046 cases confirmed in the United States. A majority of these, again, are coming out of Texas, 728 out of Texas, but 31 jurisdictions involved, many states, including Florida now documenting their second case. The news just broke, but it looks like this case was actually from April. The child contracted measles from outside the country and then came back and was diagnosed here. And it looks like the child is 0 to 4 years of age. Not surprisingly, the information coming out about these cases from Florida is very limited. But in the United States, 96% of the cases are unvaccinated or unknown. 1% have one vaccine, 2% have two vaccines. Younger kids are at higher risk for complications with measles. And looking at the US data, 30% of these kids are under 5 years of age. The total hospitalization rate for everyone is 12%, but for these younger kids, it's 22%, which is kind of on par with what we've seen historically. There have been 3 people that have passed away from measles in the United States. 2 of them were school-age kiddos in Texas who were not vaccinated and had no underlying medical history. Mexico is also struggling with their own measles outbreak, a lot of them also in the Mennonite community close to the US border. They've had over 1,000 cases as well. 4 of these people have passed away, including an 11-month-old and a 7-year-old this month. One of them had leukemia and one of them did have a kidney problem underlying. There was also a 31-year-old man who was not vaccinated and a 1-year-old girl who passed away before this month. Measles is ridiculously contagious. It's probably the most contagious infectious disease we have. But our vaccine for measles is also one of the most effective that we have. 93% for 1 dose, 97% for 2 doses. We need about 95% of people to be vaccinated to have herd immunity. And currently in the United States, we're around 92% of incoming kindergartners. And in Florida, we're about 88%, which is, it's not great. There is no medical intervention on the planet that doesn't have risks. And vaccines do have risks. Most commonly redness, swelling, pain at the injection site. It is possible to develop a fever later. There are not kids dying in masses from the MMR vaccine. In fact, if a kid died from the MMR vaccine, I'm pretty sure it would be all over social media. And it's not. It's not. Measles infections have a lot of complications. Ear infections are common. Pneumonia, unfortunately, pretty common. A lot of kids do need hospitalization, about 20 to 25%, especially with the younger ones. And then brain swelling or encephalitis, that can have lifelong complications. We typically vaccinate kids between 12 and 18 months and then again around 4 years of age. If you have any questions, please talk to your pediatrician or local health department.